Hey, how you doing? My name is Khadijah Green. I'll be your nurse for today. Today we'll be starting the IV because the nurses said you were having hydration, so we're going to start the IV on you. Provide you with some privacy. Going to lock and lower the bed. Make sure your side rails are up. And let me see your armband. All right, state your name. John Smith. Okay, John Smith. What's your birthday? All right, 1558. Okay, do you have any allergies? Yes, you have allergies to penicillin and aspirin. Okay, you won't be getting any of that today. Which side, do you have any complications with any side of your body? The left side? Okay, so we can work on the right side. Alrighty. We're going to put in the IV at this time. Um, First, we're going to use we're going to open pack. Make sure I'm being sterile. I'm going to get my tourniquet so I can find a good thing to use. Tourniquet. Okay. Palpate for a vein while checking pulse. Right, that's the great thing. Right? Under the tourniquet. Alrighty. You're going to scrub the site. Sorry, Mr. John. I'm going to wash my hands and put on my gloves. Alright. Getting up to bed with my working height since I'm too short. Okay. Listen for the crack. Alright, we're going to scrub the site for 30 seconds. Alright. Going to allow that to dry. Okay, while that's drying, I'm going to connect my extension to my I'm going to connect my extension. I'm going to connect my extension to the ceiling. And I'm going to put my goggles on before I stick. I did check the expiration on my supplies. Make sure nothing's out of date. Okay. I'm going to set this here. Alright, now expecting my gel coat, and I have a 22 gauge catheter again for Mr. John Smith, who has allergies to penicillin and aspirin. Okay. And it is okay. We start an IV on you, correct? Yes. All right. Grab it at the finger part. You're going to tie the tourniquet. I'm going to sit there right there. Reapply tourniquet. Check for pulse. Pulse is there. Right? You're going to go in at a 10 to 15 degree angle. Made a mistake, so I'm going to wash my hands, put on the gloves again, and re-clean my site again for 30 seconds. Okay. Show my belt up. All right, Mr. Smith, I'm now going to insert your IV. It's going to be a pinch. I'm going to bear down. I'm going to test it. See? Still. Right, got the blood. That there to unscrew here. And up here to there. Because I was supposed to untwist that first. That's the push that. To take my teardown. take the chevron.
Mommy, don't get out my room.
Sure. All right, Mr. Jack Smith, we have your IV in place. We're checking the lower and around to make sure you're not having no phlebitis or infiltration. Going on, wash my hands, put on more gloves because I did forget to take this off and I need to put a cap on. I will clean it with alcohol. All right, Mr. Jake. According to your physician's order, which y'all check, we're gonna start you on normal setting at 75 milliliters an hour. So I have my 500 mLs of saline, checking expiration, checking the bag. Gonna open my bag. This what I went in my sharps container. Okay. Hang my bag. This will be my primary. Okay. I get my primary tubing line. Primary tubing line. And again, I can check my routes. Again, checking your armband. Jack Smith with allergies of penicillin and aspirin. Date of birth again. 1/15/68. Okay. And the reason for this again, you said because you was having dehydration. Are you okay with that? Getting the IV? Yes. Okay. And the dosage of your saline, we say is going to be 500 mLs of 75 mLs of normal saline. They're being careful to keep everything sterile. They're going to Skype. Making sure that the ruler is closed. I did wash my hands and put on the gloves. I did. Right. We're going to prime the line and get all the air out. I'm gonna do this to one, make it to 1/2. Okay, got the drip. Down the line, get the air out of out. Got all the air out that line. I'm yeah, gonna use some alcohol to wipe off top. So hang that there. I'm gonna label, wipe off the Y ports, tap the Y port. We're going to date and time our primary line, and I'm going to tape it. Tape approximately right here. So I can still eyeball the drip chamber. Okay. Then get a label. Now it's okay to start your normal saving at 75 liters an hour, which we have it programmed in the pump already. Did a new patient and we channeled it at the right primary, the right number again, which was 75 mLs an hour for the normal saving to run first before we start any additional antibiotics or anything like that with his antibiotics. Wash my hands, put on gloves, scrub 30 seconds. Carry that together. Okay. I'm gonna start it. We're gonna open it. Roll it up till we see drops. Okay, it's dripping. All right. All right, Mr. Um, John. That that ran. Now we have an order for KZO. 475 milligrams to run over 6 hours. Did our conversion, and actually it's going to run for at 60 mLs an hour. I'm going to check your wristband again for your name and date of birth, and see if you have any allergy, which you do have allergies to penicillin and the aspirin. Bed is still in lowest position in lock, in privacy. Um, let's start that one. This is the KZO. Checking the packages, check the expiration, all that. Okay. Open it. Okay. And 1 second. I'm gonna bring this one down. And that one. That one there. And this. Okay. Primary down, secondary is up. I have my label to go on the tubing once I get it up. And my secondary. My secondary set. Check the installations. Again, temperature have it. I'm gonna open that. Primary is still running. Okay. Gonna the water chamber. Make sure that closed so air won't get in there. Alright, we're going to take the top off of that and spike egg. See? Okay. Now we're going to prime this line. Make sure you get up to the top. So we don't have a get the air out of that one until you get to the top. Slowly. Stop. Clean my alcohol. That on there for a sec. I will stop my normal saline. Wash my hands, change my gloves. I'm going to flush the lines before starting the antibiotic. And again, I will check my antibiotic on my mark to make my right checks. This is again John Smith, who has a date of birth of 1/15/58. Checking that. He has allergies to penicillin. Is it okay with us starting antibiotic? Yes, okay. All documentation was done. All right, I'm gonna wash my hands again, put on the gloves. I'm going to go ahead and open my settings so I can flush the lines before I administer my IV antibiotics. Stop it with the roller clamp. Okay. Put my scrub hub on it just to keep it sterile. Put my top on it. Alright. Still with my gloves, I will flush the line so I can begin my antibiotic. Okay. Line is flushed. Now we'll start. My line's not long enough to reach, so at this point it will be hooked up, and my K-Flox will be Kefzar will be running over 6 hours at 60 mLs an hour. That's running here. Mr. John Smith, are you feeling okay? You don't feel like you have no adverse reactions or anything? Okay, I will be back in 30 minutes to hours to check on you, and to check on your antibiotics, see is it still flowing. All right, that's still hooked up to my patient. It's just not long enough. All right, washing my hands. Back to the room. Mr. John Smith, how are you feeling? Okay, we're going to remove the antibiotic because your medicine has finished. And at this point, I heard the X-ray people say they want to do an X-ray. All our fluids are finished running, so it is okay for the X-ray. So again, I'm gonna flush your lines. I'm gonna flush your lines again, so you can go to get your X-ray done, and then we'll come back and we'll see what other orders the doctors have for you. Okay. Okay, wash my gloves are still on. I will flush, aspirate, flush my lines. Okay, that. Here's my good. Okay, I'll see you when you get back, Mr. Jack. Did they finish with your x-ray? Okay, everything's completed. I'm gonna wash my hands, put on my gloves. Okay, checking my physician's orders again. Your order calls for me to give you a 40 milligram of IV flushes, which when you would get the order says 40 milligrams, but after I did my conversion, you would get 4 mLs of basics 40. Okay. Okay. Lines have been flushed. Hands are washed and gloves are on. I'm now flushing 4 mLs of my Lasix. Okay. And I'm going to flush my line. I'm going to say it. All right, Mr. Jack. Now we have an order now to resume your normal saline at 100 ml rate. I'm gonna program on my primary side, same resident, so we can resume with all the information, which was the 60 mLs, which was we're gonna do the 100 mLs of your normal saline. So we're going to get our line, expecting it, still no air. I will scrub my hub. Turn on my roller. That's running. Okay, Mr. Jack, I'll come back and check on you in a few minutes. To see how you're doing, okay?